Hi, everyone. Hi, Dr. Jankowski and class. My name is Ma Pamela Tanwanko, and this is my interprofessional interview and CLC reflection. The professional I will be interviewing is Dominique Toison. She is a compliance liaison for Aya Healthcare, which is a travel nursing agency.
Hi, thank you for having me.
I'm glad you're here with me. The topic we will be discussing is the public health problem I worked with my group, which is increasing cancer screening tests among the Asian American population. This is a problem because cancer is the leading cause of death for the Asian American community, and this can be attributed to low health literacy, socioeconomic status, and racism and stereotypes against Asian Americans, which have started since the gold rush. Dominique, based on your experience with working with nurses and your field, what solution can we integrate to address this public health problem?
Well, from a staffing perspective, I think the most prevalent solution from my end is to staff more clinicians who are Asian American and having more nurses and doctors who are well versed in like the cultural differences within the Asian American population.
Oh, I agree. That was actually one of the solutions we've mentioned. From the public health sector, the solutions we've proposed are increasing preventive educational materials that is written in the patient's native language to break down language barriers and increase educational awareness. So this can be done through that as well. And then we also mentioned investing in care navigators because they can facilitate clinical and supportive care services, address knowledge gaps, and encourage self advocacy. Another question I have for you is what are some challenges when applying leadership and management principles to this problem?
I think the biggest challenge is that it's just such a multifaceted problem. With you have the health literacy, you have the cultural difference with Asian Americans, so it's definitely a lot of different ways that you can tackle it, and sometimes it can get a bit um, confusing and hard to tackle each problem individually, but I think having that approach and knowing that there's so many factors can be super helpful as well.
I agree with you. I would also like to mention the cultural stigma, especially the anti Asian hate during the pandemic, which can make Asian Americans, or that community, hesitant to seek and trust healthcare providers. But an opportunity with that would be to create partnerships or collaborations that can help with community outreach.
I agree. I think having, like, from a staffing perspective, having nurses who are well versed in the Asian American population and know how to interact with them and communicate with them will be super helpful in destigmatizing like the screenings and making sure that patients are aware of how beneficial it is for them.
I agree with you. Thank you for your input and your perspective, and taking the time to discuss with me about your field. I hope within the next couple of years, the prevalence of cancer among this community will greatly decrease.
Thank you for having me.
At this time, I will be discussing my reflection on the CLC. During the CLC collaboration with other learners, I found myself as one of the leaders who initiated and guided the team on the assignments. In the first group assignment, I was able to understand and learn my leadership style and emotional intelligence based on the quizzes. I agree with the results because this was the path and technique I usually portray with my current work during other group projects during my undergrad years and during this class's group assignments. While interviewing Dominique, I learned that her leadership style is similar to mine and that we are both democratic leaders and facilitate discussion between our team members. While collaborating with my group and creating our public health intervention and crisis management plan, I learned that I could voice out my own opinions and listen to my team members as well and come to a conclusion on what is the best idea to achieve the best outcome. As the weeks went by and we kept working together, we understood each other better. There will always be differing opinions, but our priority was what we can do to deliver the main message. Coming into the group assignments, I was worried about how we could collaborate and deliver what we wanted to display. However, after continuous communication, I would feel confident being a leader of an interprofessional team because I prioritize listening to everyone's perspectives and then maneuver a way to include everyone's ideas into one. Although I do not have the proper abilities and self confidence leading a team, especially when I first started before the group assignments, my role as a leader in the CLC group strengthened my abilities and I learned something new from every team member of our group. For instance, I learned that constantly showing appreciation to my team boosts morale and it encourages us to keep working better. That is all. Thank you for watching my interview and my reflection. I hope you have a great rest of your day.